And welcome back. Before the break, we showed you all of the things that President Biden is trying to cram into his first 100 days, and we spoke with a congressman about health care and how the president's working to shore up Obamacare as well as improve access to it. The president's also trying to speed up vaccinations. He's done a lot of things on that front. The government now sending more than 1 million doses to thousands of pharmacies, making it easier for people to get the shots. The administration says it's increased supply by 20% since Biden has taken office. So more doses are getting sent out, and FEMA pumping billions of dollars into the states to reimburse them for some of the money that they've spent on things like testing and inoculations. Another huge issue is, of course, the schools. Some of them, they've gone back to some semblance of classroom learning, but tens of millions of kids are still at home, stuck with online learning here as the remoteness has not worked by any testing standard. And it's caused a bunch of unintended consequences. Things like spikes in depression and even suicide. Several places, including big cities like Chicago and San Francisco, are openly battling with their teacher unions because those unions say that their members don't feel it's safe to actually go back into the classroom. But the head of CDC says they can open and they can do so safely.
There is increasing data to suggest that schools can safely reopen, and that safe reopening does not suggest that teachers need to be vaccinated. Vaccination of teachers is not a prerequisite for safe reopening of schools.
And apropos of that, tomorrow on this program, we're going to be speaking with the head of the largest teachers union in America about the issues that their members are facing and also concerns about safety. But now I want to bring in our next guest, Lori Tremmel Freeman. She is the Chief Executive Officer at the National Association of County and City Health Officials. Lori, last time we talked, I had questions about the logistics of getting the vaccine into the arms of Americans, and so much has changed since then, including a new administration. How comfortable should we be that with each succeeding week, the logistics and the volume of this vaccine and these vaccines are there so the people you're dealing with actually have the supply to meet the demand?
Well, we should be fairly comfortable that things are progressing as we had hoped that they would, especially under the new administration who's paying close attention to things like the supply chain and the ancillary supplies that have to go with the vaccine. That said, there's still going to not be enough supply to meet the demand, at least for the next few months. So we are going to still have to rely on that all-important work of prioritizing the populations and layering on it what's going on the ground in communities onto the good advice from the federal government in terms of those priority groups. But we're making headway.
In terms of very helpful new elements in the fight to get the more vaccinations into arms, what do you value more? That the Dodger stadiums, the Yankee stadiums, huge arenas now are being turned into giant inoculation sites, or that pharmacies now are going to be getting as many as 1 million doses to do it more on the local level? What elements on the ground are making your life easier as you're dealing with the local and state officials who are saying, hey, Lori, whatever you got to do, help me get this stuff here so I can inoculate my people?
So we need all of these partnerships. So there's not one that is necessarily more important than the other in terms of the partners that are helping us get vaccines into people's arms. But at the same time that I say that, the local health departments and the public health system at the state and local levels, they have to work in parallel, side by side with these other partners to ensure that we're tracking things like how we're doing with vaccinating the entire population. How are we doing with prioritizing those really vulnerable areas of the population? And how can those partners like pharmacies and stadiums really help us to ramp up what we're already able and capable of doing, but to do it more broadly and to maybe reach special populations that we may not be able to reach ourselves in the public health department.
We played coming in the new head of the CDC saying vaccination should not be a prerequisite for teachers to open up schools. The mayor of Chicago has been very strong here, saying they've taken the mitigation efforts, the filtration systems in the schools here, enforcing mask wearing, distance, separation from student to student. Obviously, this is a question I imagine you've been getting a lot here. I guess the fear of making the perfect the enemy of the good, for lack of a better way of framing it. How does your organization stand in terms of, I understand legitimate fears of teachers, but at the same end, the science says we can do this even if we haven't inoculated teachers, assuming obviously they don't have underlying conditions.
So one of the keys here that the rescue package that Congress is considering now attempts to address is that big investment in testing, $50 billion investment in testing that will kind of take us over to the point where we become more comfortable opening schools, because we will have the supplies and the tests that we need to routinely ensure that people are being kept safe, and if they do have are exposed to the virus, including teachers and students, that we're able to isolate them and control the spread. So it's science and it's testing. So just the tried and true mitigation measures that we've been talking about all along. A vaccine will come, and it will come sooner rather than later, and everybody will get vaccinated. But right now we have some mitigation measures that can help if we're able to invest in those now, and those should help the teachers feel more comfortable as well.
And by the way, should we prioritize teachers as the same way we do with first responders, where whether it be in the medical front lines, law enforcement, fire, they get special dispensation, if you will, regardless of age? Should we treat teachers the same way?
I think anybody that has added exposure to get the virus or spread the virus should be in those priority groups. But there's a lot of people in those priority groups that fit the same bill as the teachers. So there's a lot of competition right now for a limited supply. It will ease over time. We will get more vaccine. We'll be able to vaccine all of these folks in these priority groups and move on to the general population. It's really hard to say what priority one public facing group takes over another. But I believe that, with these mitigation measures, added tests, added vaccine, and just the pure old fashioned mask wearing, distancing, washing your hands, all these things will help us to move forward with this.
And finally, and again, Lori is the CEO at the National Association for both county and city health officials. We're starting to see airlines and even arenas saying, listen, you don't get the inoculation when we open things up, when the world opens up again. You're not coming through our doors or boarding our plane or whatever else. I know you say, hey, at the end, everybody's going to get it. Already people that are being offered, some are refusing it. Do you think that that's going to fly, that that's going to be a fair expectation, that, listen, for a non-required thing like going to a game or a concert, I got to show I was inoculated if I want a seat?
It could come down to that, especially when we are faced with these shortages in supplies and we're seeing things open and activities, resume without having our full vaccination in place for the whole country. We could see those kinds of measures take place and be enacted. And I think, in some cases they're fair in terms of community protections. And at the same time, we also realize that there is hesitancy with taking this vaccine. We're making a lot of progress in terms of overcoming that with folks, but we still need to be able to answer their questions about that they can trust the vaccine, that they can trust who's giving them the vaccine, they can trust the education they're receiving around the vaccine, and that they know where to go if they have questions or issues when they get the vaccine. And if we are able to address that, those numbers will decline and we'll get more and more people vaccinated. But there definitely could be some measures as we continue to try to protect people from the spread of this disease.
Lori Freeman, I always appreciate the time. Thank you so much. All right, folks, when we come back, we'll wrap things up on RFL. Please stay with us.